Hola. 2017. Bradley, 43 years old, and his wife was working on decorating some pumpkins for Halloween when they heard a very weird and deep sound. Under shock, they stopped what they're doing for how weird the sound was. They heard it a couple of times before realizing that it's coming from Bradley's nose. For that, he referred to a doctor, ear, nose, and throat specialist. The doctor told him he had a deviated septum, right here shown in the picture. This is how a normal septum should be like. The septum is the bone separating the two nostrils. For Bradley, it was not straight. So the doctor recommended two surgeries. One for the correction of the deviated septum. The other operation was a near total removal of turbinate in each nostril. Now, what is a turbinate? Small structure. There is 3 turbinates on each side of the nostril. Their role is to cleanse, warm, and humidify the air flowing into the nose. Now, the problem is that sometimes, in Bradley's case, those turbinates can become enlarged and inflamed, making breathing semi-impossible. Even if the septum was set correctly straight, it will make breathing very hard. So, the 2 surgeries were done, and the very bothering symptoms seem to be acceptable for the meantime because it's gonna take a few days for him to be relieved completely from the symptoms and to breathe again freely without any sound coming from his nose. But this now semi-empty nose he had is only getting worse. Even though it's empty, he always felt he cannot breathe correctly from his nose. He couldn't sleep right, fatigue crushed his body while he was desperately breathing only from his mouth. In the upcoming 18 months, Bradley saw dozens of doctors. Some presume that every symptom he's feeling is only in his head, psychological symptoms. Some refer that there is a small benign tumor-like inside his nose and removed it, but nothing really helped him. His breathing from the nose was only getting worse. He tried so many different nasal sprays. He tried so many different medicines. He tried anti-allergy. Nothing really worked. He even tried sleep therapy. He checked his heart function. Every single blood test, every single x-ray seemed to come back very normal. In the meantime, he lost all the ability to do his hobbies like playing hockey or even photography up in the nature because he couldn't breathe freely. He wouldn't play with his kids anymore or get out with friends in any closed space because he would very soon start gasping for air. He fell into deep depression and only was gaining weight because of gaining a new bad eating habit. That is until 2023, when he spoke to a specialist in US Institute for Advanced Sinus Care and Research, and the doctor told him that he had a very rare condition called empty nose syndrome, which is a condition that happens usually after removing turbinate surgery from the nose. It is unexplained why some people, although their nose is empty after the surgery, suffer from relentless and severe nasal congestion and loss of ability to breathe correctly and freely from the nose. A very controversial condition since removing turbinate usually leads for the people to breathe better. But in empty nose syndrome, after the turbinate removal, it's making the breathing very impossible. Now, we don't understand the condition very well because it's very rare and we have very limited studies, but there's a theory that supposes that a tissue in the turbinate has a receptor that signals and coordinates normal airflow through the nose, and in some people that has this very rare condition after turbinate removal, breathing and airflow becomes obstructed even though the nose is empty. The coordination of the airflow through the nose becomes lost. Now back to the hospital, the doctor positioned a small cotton inside Bradley's nose in place of the removed turbinate. It was only here, after years, that Bradley could for the first time breathe freely and directly through his nose. He almost cried out of happiness that he can finally experience this feeling again, inhaling through the nose. The doctor then injected a gel-like material which is made from carboxymethyl cellulose filler. It is used in medicine, and put it right where he put the cotton. 6 injections. It has to be repeated every few months, every 6 months or 1 year, and for some reason it can make breathing better. It can fix the problem even if temporary. Although it doesn't bring back the lost nerve from the nose or the receptors lost by the turbinate tissue removal, but it is indeed a temporary relief for inhaling, breathing through the nose normally. Bradley was very satisfied that after 6 years, he finally can go back to whatever life he had before, when he breathed correctly, inhaled freely, and even sleep like normal people do, breathing right and sleeping tight. I am Arish, and this was an episode of Simplifying Rare Medicine. Don't forget to like and subscribe. Adios.